friends, I just watched a video that came inside this book, Clinical and Experimental Hypnosis in Medicine, Dentistry and Psychology, where Dr. William S. Kroger performed the first thyroidectomy ever performed without any anesthesia or analgesia, where the patient was under hypno-anesthesia exclusively. Even after performing hypnosis myself the past couple of years, I was both stunned and amazed by this video. Since I'm unable to share it with you due to copyright, I noted the highlights and wanted to share with you instead in this review. This is part one of a two-part review series. Part one will cover the highlights of the surgery performed while a patient was under only hypno-anesthesia. Part two of this review series will cover my findings from the book itself. Coming soon. Important, and please note, this surgical procedure was used and performed by a licensed medical practitioner, with the patient being gradually primed for the procedure several weeks in advance. My purpose in sharing this review with you today is to both amaze you too and to reaffirm the power of the work we do for our clients. Do not try this at home, folks. This post is strictly for educational and informational purposes only. Dr. Kroger defines hypnosis not as sleep or unconsciousness as we know, but rather hypnosis is characterized as a hyperacuity of all the four senses. He said that there are four ways of producing hypnoanesthesia: direct suggestion, association, amnesia, and glove anesthesia. We prefer the latter because it is, in reality, patient-oriented hypnosis and enables the hypnosis to be woven into the fabric of the patient's own personality. I love that. Furthermore, motivation is increased and better results are obtained. A side note to my fellow storm riders in the Mike Mandel Hypnosis Academy: we know how much Mike loves glove anesthesia. Not only does he teach it flawlessly, but also attested to his own using it for a serious burn he had on his hand that resulted in reducing the pain, inflammation, and initiating faster healing with, I believe, no scarring. Do not underestimate the power of glove anesthesia to help your clients reduce or eradicate pain. And now, back to the review. Dr. Kroger used a variation of the Omen induction along with anchoring and association techniques that would enable the client to go in and out of a deep trance quickly. These were practiced on the client over several weeks until the client had mastered these techniques and could go into a deep hypnotic trance with the simple touch on her shoulder. He also took the patient through a full mock surgery where the surgeon spoke out loud, announcing every movement step by step, along with letting the client know in advance what sensations they would be feeling. For example, he would say something like, "We are now going to remove the thyroid. You may experience a slight tugging." This surgery rehearsal prepared the client as to what to expect, which enabled them to remain calm during the actual procedure because it was familiar to them. During the thyroidectomy itself, the patient remained awake and communicative. She was fully aware of what was transpiring, and the medical team was able to monitor her comfort throughout the procedure. Dr. Kroger also reported minimal bleeding during the surgery, which had been a direct suggestion during the client's previous hypnosis sessions. Upon being slowly dehypnotized, the patient was able to talk to the doctor almost immediately in a manner that would not have been possible until several hours postoperatively had she not been hypnotized. The patient was able to hop off the surgery table without any assistance, and the hospital staff were amazed by the results of such a major medical procedure. The patient was then sat comfortably in a chair and placed into a somnambulistic state where she was given post-operative instructions that she could walk, talk, eat, swallow, sleep, and be free from all discomfort without the need for any medications. The patient was then brought out of hypnosis again and moved to her own recovery room in excellent condition. Dr. Kroger added that hypnosis also has many advantages post-operative, and this is where we can shine. Surgical patients, especially those who have had large incisions in their upper abdomen, are usually afraid to cough afterwards for fear of excessive pain. Through post-hypnotic suggestions, well-trained hypnotic subjects can have their pain eradicated in a matter of seconds. The gag and cough reflex can be regulated, and post-surgery vomiting can be easily decreased or eliminated completely. When hypnosis is used in place of opiates for pain, there's better healing of the wound as a result of better nutrition and without any drug side effects or risk of addiction. During the 5-week post-operative interview, the patient said, quote, "I think that I've had a unique and rewarding experience, and I'm very happy that I had it done this way." End quote. When Dr. Kroger asked her how much discomfort she experienced during the procedure, she replied, "I had very little discomfort." The doctor then asked the patient if she was aware of everything that had happened during the operation, to which she responded, quote, "Yes, I was. From the beginning to the end, I heard everything that was said and knew everything that was going on." End quote. Dr. Kroger mentioned that the nurses had commented that the patient did not experience any post-operative pain, to which she replied, "That's right, absolutely none." Again, do not try this at home, folks. My aim in sharing this with you is that it will support and reaffirm your understanding of the power of hypnosis and of the human mind and of our ability to manage pain, discomfort, and healing in a natural, healthy way, free from drugs with harmful side effects. If you like this video, please give it a thumbs up and subscribe to my channel for more educational and practical hypnosis videos. And stay tuned for part 2, where I will review the book itself. You can even turn notifications on to receive an alert when part 2 of this review is posted. And if you would like to experience relief from chronic physical or emotional pain, feel free to visit my website at zeldahypnosis.ca to schedule your complimentary consultation to see if hypnosis is right for you. Thank you for watching. Until next time, take care and God bless.